Hey there, this is Alexa Demuda, your aspiring dentist. So today we will be talking about sealants and preventive restorative resin. Let's start off with sealants. Sealants are the safest and painless way to protect your teeth from tooth decay. A sealant is a protective plastic coating which is applied to the biting surfaces of your back teeth. Your back teeth or your posterior, like your molars and your premolars. So first, of course, after the tooth is thoroughly cleaned, of course, we will prepare it. We will remove if there are any caries. Afterwards, we will put a special solution we call an etchant. An etchant makes our teeth a bit more rough so that there would be more retention. It is dry. We actually put the sealant on the pits and the fissures, and then we allow it to set hard by shining a light into it. What kind of light? That is our light cure. So once it is done, you are good to go. See? Pits, pits and fissure sealants are so easy to do. It is just 15 minutes and it is such a good foundation for your child's teeth. Preventive resin restoration is a thin resin coating applied to the chewing surfaces of the molars and premolars, any deep grooves of teeth. More than 75% of dental decay actually starts in the deep pits or the deep grooves of the teeth. So that's why we are taking very big precaution in this. How we actually do it. Okay, so teeth to be sealed are thoroughly cleaned and dried before, and it is usually surrounded with cotton to keep it dry. Special solution is applied again to the teeth before we etch it first with our etchant, okay, for 20 seconds. After that, we will rinse it and we will dry it very nicely. After that, we use our bonding agent to make sure the resin bonds very well. Light cure to make sure it sets very well. Very ready for our resin we will use. Okay, we're ready to put our flowable. So for this one, we are using A2. We are done. See, it only takes a couple of minutes to invest. You can protect them and their teeth. Beat the stigma that says just because they are temporary doesn't mean we should lose them earlier than we should. So this is Alexa Di Mayuga, your aspiring dentist. Thank you so much and I hope you learned a lot. See you next time. Bye!